Hello and welcome back. This is Gilbert again, and today I'll give you an overview of maternal health statistics. The United Nations Millennium Development Goal number 5 aimed to reduce maternal mortality by 75%. And between 1990 and 2013, maternal mortality dropped by almost 50%. But maternal death remains very high in low-income countries, in sub-Saharan Africa, and Eastern Asia. Of the close to 800 women who die every day, 500 live in sub-Saharan Africa, 190 in Southern Asia, and only 6 in high-income countries. That means that over 99% of all deaths occur in low-income countries. The sad thing is that most of these deaths can be prevented through skilled care and access to right facilities. In sub-Saharan Africa, less than 50% of women are attended by a trained midwife, nurse, or a doctor. There are some groups of women who are hit harder by the disparities in maternal health care in our societies. Young or teenage mothers is one such group, and the risk of maternal death is greatest for girls under the age of 15. In low and middle income countries, 1 in every 10 girls becomes a mother by the age of 16. In comparison, the teen pregnancy rates in high-income countries like Canada and Sweden is about 3%. Adolescent pregnancy is not only problematic from a maternal health perspective, it also forces many girls to drop out of school with long-term consequences for their futures and also for those of their families and their communities. Poor and uneducated women is another group that is hit harder. Women in remote areas are the least likely to receive adequate maternal health care. This is particularly true in regions with low numbers of skilled health workers. In high-income countries, virtually all women have at least 4 antenatal care visits. They are attended by a skilled health worker during birth, and they receive postnatal care. In low and middle-income countries, less than half of pregnant women receive this continuum of care. Another group is women in communities where women's health is valued less than that of men. Parents may prioritize their sons over their daughters, and girls and women often don't have control over financial resources or access to transportation. This means that many of these women are dependent on male relatives or their mother-in-law for mobility and access to health services. The last group I will mention here is women in countries or communities where unsafe abortion is prevalent. About 22 million unsafe abortions are performed each year, and it's estimated that this leads to 47,000 deaths and more than 5 million complications every year. And almost every one of these deaths and complications could have been prevented. So, is there hope for the future? Well, the situation is dire in many places. We need to improve access to maternal health and make sure that the right care is available to all women. The many different factors that prevent women and girls from accessing high-quality maternal care are interlinking and complex, but there are approaches that have proven more successful than others. The 3 delays model is an integrated maternal health approach that recognizes the different barriers women face in achieving timely and effective medical care needed to prevent death occurring due to pregnancy and childbirth.